Hi, I'm Dr. Brian Thornburg, and let's discuss what is happening with the old and new CDC vaccine schedule. We see a split in states about which schedule they are going to either continue to endorse the old vaccine schedule or the majority of states are moving with the adoption of the new vaccine schedule, which has fewer vaccines. And just as a quick note, the old vaccine schedule vaccinated for 17 different diseases. The new schedule vaccinates for 11 different diseases. And what we see is that 17 states have decided not to adopt the new vaccine schedule with fewer vaccines, while 33 states are either in the process of adopting or have not spoken out publicly that they are going to dissent from the CDC's current recommendation. Largely, we see a red state, blue state divide along this issue. The vaccines that were removed were COVID, flu, rotavirus, hepatitis A, hepatitis B, and meningococcal disease. These were moved into a category of shared decision making where the physician and the family would decide together if these vaccines should be administered. And I wanted to take a look at the actors that are mostly on the dissent column. For those of you who have been following my website or are my patients, you know that for the last 20 years I have been discussing vaccines, vaccine safety, vaccine effectiveness, efficacy, and we looked at the historical disease burden when the vaccines were released for public use and the effects that these vaccines have had in terms of decreasing the disease burden. And this vaccine, I've been doing it for about 18 to 20 years with my current vaccine lecture. And what I find most interesting is the vaccines identified 18 years ago as having low efficacy in terms of decreasing the disease burdens are the ones that the CDC has eliminated or moved into the shared medical decision-making space, except, of course, for the COVID-19. And, of course, that's a newer vaccine, so that was not included. But if you go back and watch my COVID vaccine from 2020, you will see that I did not find that this was a necessary vaccine for children because the disease burden was almost non-existent in children in terms of having a bad outcome. So I find that just with my own analysis over the years, it's supported now with the CDC, obviously identifying similar concerns that there isn't a point to administer these vaccines, given that the vaccine has not decreased the disease burden in a significant way. So why is the American Academy of Pediatrics continuing to endorse this older schedule with 17 different diseases? And I wanted to look at what the American Academy of Pediatrics has done for pediatric healthcare, because we really have to understand what the AAP has done and why they're positioning themselves currently, because we have to understand the past to understand the going forward. So the American Academy of Pediatrics are advocates for children. They represent a membership of pediatricians across the country, and they have essentially been charged with providing guidelines and medical recommendations for health for children. Pediatricians, for the most part, use their recommendations as a guiding beacon on terms of standard of care. And I wanted to look at what the AAP has done for pediatric care over the last 40 years, really since the vaccine schedule has exploded. And to start out with, let's just look at the incidence of chronic disease or the chance of any child developing a chronic disease back in 1992, and it was about 12%. And this would be diabetes, this would be some kind of neurological problem, this would be ADHD, obesity. So it was about 12%. And currently, the chance of any child in the United States developing a chronic disease is 40 to 50%. So that's a 4x increase in terms of the chance of any child developing a chronic disease in their lifetime. And again, the American Academy of Pediatrics has essentially been charged with safeguarding the health of children. And when we look at chronic disease measures, they have not done very well. So let's look more specifically back into vaccines, because vaccines are designed designed to help prevent disease. We give them to infants because we want to start protecting them from the beginning of life, or at least that's the argument that the American Academy of Pediatrics is stating. When we look at where American children are in terms of infant morbidity and mortality, that is the incidence of disease or death, the United States ranks very poorly. We are 54 to 57th, depending which metric you're looking at, out of 227 countries. That means that we are at the bottom of the first quartile of all countries. But when we look specifically at developed countries, Europe, Asia, where we're in first world countries, we rank 32 out of 38 in terms of infant morbidity. That is the death measurement. When we look at at mortality, that's the death measurement. Morbidity is the disease burden. When we look where the United States is today, we rank lowest among all developed countries. So when we stop to look at what the American Academy of Pediatrics guidelines or recommendations are doing, and they tout themselves to be scientists, to be rational, to only look at the data for outcomes-driven measurements, we wouldn't end up in this place. We wouldn't end up last in infant morbidity. We wouldn't end up 32 out of 38 for infant death rates. And so there has to be some other inputs that is influencing the American Academy of Pediatrics movement through the scientific literature and drawing their conclusions. There has to be some other metric, because science doesn't lead you to a 4x worsening of chronic disease. Science doesn't lead you, as one of the greatest healthcare countries in terms of resources, to dead last in terms of first world countries and infant morbidity, and certainly not in the bottom 25% for infant mortality. So the American Academy of Pediatrics, in my opinion, has been captured. It's not a castigation against the American Academy of Pediatrics. Any organization over time is going to be captured, and it needs to rediscover itself. And I believe that that's where this organization is. If you just look at their website, you can see who their sponsors are. It's big pharma. It's formula companies. They're the corporations who stand to profit from having guidelines lead to more utilization of their products. Clearly, they're not sitting in a back room in a big smoky kind of that mental picture of a corporate boardroom, deciding to purposely poison children so they have to use more drugs. It's not that level of conspiracy, but there's a groupthink that has evolved over time. And instead of just focusing on science, non-scientific metrics are being injected. And again, we're looking at health outcomes. We're not in a social experiment here, but they have injected ideology. They have injected belief systems. And so when we return back to looking at the vaccine schedule, here I was 18 years ago identifying which vaccines didn't really contribute to decreasing infant morbidity and mortality, that it really was just kind of a push, because the real benefit came from improved sanitation and food supply and supplementation and access to medical care and education and infrastructure. So it's no coincidence that the new CDC schedule is now following an outcomes-driven approach, and this older organization that still has ties to kind of old laws or a system of laws or customs, and they're having a hard time acknowledge that vaccines aren't always safe, that they, just because they're on the schedule, that they necessarily work. So what we're seeing is the country dividing along party lines. I think it's very clear that the American Academy of Pediatrics isn't just using science to help decide how to promote pediatric healthcare in this country, as evident by infant morbidity, mortality, and if again, just looking at other first world countries, they offer their population fewer vaccines than even we do here at 11, and they have powerful health outcomes. That they're not having vaccine preventable epidemics of diseases. So it's really important to stop and consider who the actors are, why they're making this recommendation, and it's just not being backed up by the science, because essentially what's happened is the American Academy of Pediatrics has turned your child's health outcomes and futures into a coin flip, 50-50 chance.